Hi friends, welcome once again to our YouTube channel Nursing Exams Preparation. This is the second part of Nimhans Nursing Officer Important Questions and Answers. So let's start the topic first. Which among the following is a chemotherapeutic agent? A. Mycostatin, B. Chlorpromazine, C. Triaxiphenydyl, D. Cisplatin. Option D. Cisplatin is the right answer. Drug of choice in breast carcinoma. A. Methotrexate, B. Tamoxifen citrate, C. Chlorambucil, D. Clotrimazole. Option B. Tamoxifen citrate is the right answer. Tamoxifen citrate is an anti-estrogenic drug used in treating and preventing breast cancer. Among these, which of the following drug is cell cycle specific anti-neoplastic medication? A. Cisplatin, B. Cyclophosphamide, C. Methotrexate, D. Chlorambucil. Option C. Methotrexate is the right answer. Cell cycle specific anti-neoplastic medication affect the cancer cell only during a specific phase of cell cycle. Example methotrexate, which affect the S phase of the cell cycle. Rule of 10 is used for A. Cleft lip, B. Cancer, C. Imperfect anus, D. CHD. Option A. Cleft lip is the right answer. Rule of 10 is the criteria used to judge the readiness of an infant for surgical repair of a cleft lip. The infant must weigh 10 lb, be 10 weeks old, and have a hemoglobin value of 10 gram and have a WBC count less than 10,000. What is important nursing care for children with acute lymphocytic leukemia on chemotherapy protocol? A. Preventing physical activities. B. Checking their vital signs too hourly. C. Having them avoid contact with infected person. D. Reducing unnecessary stimuli in their environment. Option C. Having them avoid contact with infected person is the right answer. Earliest symptom of carcinoma cervix. A. Postcoital bleed. B. Foul smelling discharge. C. Pain. D. Irregular vaginal bleed. Option D. Irregular vaginal bleed is the right answer. Which of the following laboratory test is important for patient on chemotherapy? A. WBC, B. Electrolyte, C. RBC, D. Blood urea nitrogen. Option A. WBC is the right answer. Blood drawn for complete blood count is collected in A. EDTA vial, B. Citrate vial, C. Plain vial, D. Chloride vial. Option A. EDTA vial is the right answer. The expulsion of an embryo or fetus before it is viable is called A. Surgical abortion, B. Miscarriage, C. Abortion, D. None of the above. Option C. Abortion is the right answer. The tiger mosquito is A. Anopheles, B. Culex, C. Aedes, D. Mansonia. Option C. Aedes is the right answer. Aedes mosquito is also called Asian tiger mosquito because it is black and white striped appearance. In India, which of the following function as first referral unit? FRU. A. Subcenter, B. Primary health center, C. Community health center, D. Regional hospital. C. Community health center is the right answer. Which joint movement is restricted in a patient with pericapsulitis of shoulder? A. Adduction, B. Flexion, C. Abduction, D. Extension. Option C. Abduction is the right answer. Pressure by the upper end of a crutch may cause injury to A. Axillary nerve, B. Long thoracic nerve, C. Median nerve, D. Ulnar nerve. Option A. Axillary nerve is the right answer. Phagocytosis in the CNS is done by A. Astrocytes, B. Schwann cells, C. Microglia, D. Oligodendrocytes. Option C. Microglia is the right answer. Dark and tarry color stool is termed as A. Epistaxis, B. Hemoptysis, C. Melena, D. Hematemesis. Option C. Melena is the right answer. Vomiting of blood is called epistaxis, B. Hematemesis, C. Hemoptysis, D. Hemothorax. Option B. Hematemesis is the right answer. Brain damage caused by accumulation of abnormal level of toxic bilirubin in the brain is known as A. Jaundice, B. Kernicterus, C. Isoimmunization, D. cephalohematoma. Option B. Kernicterus is the right answer. Combination of core congenital cardiac abnormality is known as A. Patent ductus arteriosus, B. Stenosis of pulmonary artery, C. SD, D. Phatrology of Tallet. Option D. Phatrology of Tallet is the right answer. Which drug used to inhibit milk secretion after delivery? A. Estrogen, progesterone, B. Bromocriptine, C. Testosterone, D. All of the above. Option B. Bromocriptine is the right answer. If gut motility is increased, then drug absorption is decreased, B. Drug absorption is increased, C. Drug absorption is not affected, D. Nothing definite can be said. Option A. Drug absorption is decreased is the right answer. Autonomic dysreflexia occur in A. Spinal cord injury above T6, B. Phantom limb syndrome, C. Complex regional pain syndrome, D. Sudic osteodystrophy. Option A. Spinal cord injury above T6 is the right answer. What is cardinal sign of meningitis? A. Chaustock sign, B. Trousseau sign, C. Ortolani sign, D. Kernick sign. Option D. Kernick sign is the right answer. The nurse would conclude that a patient was experiencing hypoglycemia if the assessment finding included A. Diaphoresis and restlessness, B. Rapid threaty pulse, C. Vomiting and bradycardia, D. Rapid and bounding pulse. Option A. Diaphoresis and restlessness is the right answer. The chief regulator of immune mechanism is A. Plasma cell, B. B lymphocyte, C. Helper T cell, D. Suppressor T cell. Option C. Helper T cells is the right answer. CD4 T helper cell, a type of T lymphocyte, serve primarily as regulator because it secreting cytokines that stimulate the activities of other WBC. A question for you friends. Cleft lip surgery is done at A. Birth, B. 6 to 9 months, C. 3 to 6 months, D. 9 to 12 months. So please put your answers in the comment box below this video. So thanks for watching my YouTube video. So please do like, share and subscribe my YouTube channel.